When did WPP kick in? When do you remember the first interaction?
Well, we had been going for a good number of years, probably 10 years or 15 years. And one of my partners is Rob Brown, and his wife is Donna Brown, who has been on the board of WPP. So they started coming with us late 90s, maybe,
Right.
mid-90s, late 90s. And we were maybe 2000, maybe.
Right.
We were down, and Donna had a patient with, I think it was a rhabdomyosarcoma.
So it's a cancer of the eye,
Of the
eyeball.
A little kid.
Yeah.
And it was something we couldn't do down there, and it needed radiation also, which they don't have down there. And it was just by chance, Kenlo Nelson, who's also been on the board, who's one of my partners, been going to Belize for years, same thing that we were doing, and he had met Susan Rickman, who had just joined International Hospital of Children at that time, which became World Pediatric Project. Susan had come over to talk to me, again, serendipitously, about St. Vincent right before we went. And so we had this kid, and I'd only met Susan once, and I said, well, maybe we should call these guys because I think this is what they want to do. And so Donna got in touch with Susan and said, we had this kid that needs to come up or is going to die. And I think it was the first child.
It was the first
the
child.
first child that WPP brought to the U.S. And it was, it was like magic.
And that,
they
and
did
that
all the
boy
work
is in his 20s now and alive.
and alive.
Yeah.
And that introduced us, and then Susan had the wherewithal and realize that this might be a spot that we could move WPP into, and it had access to the local medical community with Dr. Ballantyne, who was influential in the island, and could we use that as a hub? And the truth is, she took it and ran with it, and worked with Freddie, and then got in board with the government, and then expanded on what we were doing to where, all of a sudden there's a team going every, month and a half or so, or 2 months. And it took us from plastics and urology and ophthalmology to all the subspecialties, and it actually it's crazy when you think about it.
You wanted to talk about the hydrocephalus?
There's a story I would love to tell. So we would go, we went solo for years and years and years, and there was the pediatric ward was an open air ward, and there would be about 40, 50 patients there, maybe 30 to 50. And there was an entire row of patients with hydrocephalus. They had giant heads because they had a blockage in the cerebral fluid. And every year, there were always about 5 or 6 or 7 of them. And every year there'd be one gone because they died, and a new one because their parents couldn't take care of them anymore. So then John Ward started coming, and then Gary Teig started coming. For them, that's such a simple operation.
What is the intervention?
It's to put a shunt in so that the fluid can't build up in the brain, and it circulates, and their heads don't get giant anymore, and they're normal functioning people. And there is no hydrocephalus. First, there's no hydrocephalus in St. Vincent, and now there's no hydrocephalus in the Eastern Caribbean. And they come down, and in a week, that hydrocephalus line of babies is gone, and they fix that.
Is there an example of the multiplier effect, or of the dollar going very far? I've always wondered about that.
The doctors are donating their time. Most are help paying for their way down there.
We get the equipment donated from the medical supply companies.
It is leveraging.
The nurses donate their time to go down. The speech therapists donate their time.
For a really small investment, small amount of overhead, you can truly change someone's life for 70, 80 years. And it's hard to value it, but it has real value, because those people are now productive members of society, or otherwise they were not going to be able to do anything.
Any closing thoughts, both of you?
It's changed our life.
It has changed our life. That's a good note to end on. You do this because you want to make the world a better place, but in the end, it makes you a better person. It makes you realize what's important in life, and it brings so much meaning to your life. and that's priceless.